I think what people, the biggest mistake people make is accepting these guidelines from their physician without doing further research. And one of the most common things given to people with drugs, given to people with heart disease or angina and some other issues, is a statin drug, also known as a cholesterol-lowering drug. What are the dangers of using a statin drug, Dr.
Well,
Lindsay?
the purpose of a statin drug is to lower cholesterol, right? Why would you want to lower cholesterol? Well, what's taught by the drug companies and it's taught in the medical schools that cholesterol causes heart disease.
Right, right.
And which is false. Cholesterol does not cause heart disease. Heart disease is caused by inflammation of the arteries. Cholesterol and lipoproteinase simply provide a Band-Aid over that. Half the people that die of heart attacks have no elevation of their cholesterol whatsoever and don't even have high blood pressure or diabetes. Half the people that die of heart attacks don't have elevated cholesterol. So why did they die of heart attacks? Well, it's cholesterol. If they had normal cholesterol, why did they die?
Right.
Because cholesterol has nothing to do with, it doesn't cause heart attacks. It's the inflammation. It's the inflammation in the arteries that does it. Cholesterol, on the other hand, has very important. Where does cholesterol come from? Well, 80% of the cholesterol in your bloodstream comes from your liver. You make cholesterol. It is the building block of your sex hormones. All the steroid hormones, you think steroids are bad for you? They're not. Your body makes natural steroids. Testosterone, estrogen, progesterone, aldosterone, cortisol. These are all natural occurring hormones that your body makes. And the building block, the first molecule the body uses to make the hormone is cholesterol. Sterol.
Can't be that bad if your body's
your body
making
makes that.
Right.
And you need that. Every cell in your body is lined with a cholesterol membrane, which enables the nutrients and the byproducts of the cell's functions to pass in and out. Your arteries, your nerves have a cholesterol coating around them. In the brain, you have cholesterol in your brain cells. Your gallbladder makes bile from cholesterol. So cholesterol is a very, very important and essential chemical substance that the body makes. Now, when you take a statin drug, what you're doing is you're poisoning the liver and the enzyme process that makes cholesterol, so you quit making the cholesterol. It also causes you to quit making a very important molecule called coenzyme Q10, which is extremely important for energy production in your cells, particularly in the heart. And so it cuts down on energy production in the heart. That's why people with that are on statin drugs, there's a certain percent of those people that will go into heart failure, and I'm convinced the heart failure is caused by the destruction or inability to produce coenzyme Q10, which is necessary for the heart. So if you are taking statin drugs, I would, if you were a guest of ours here at the center and you were on statin drugs, and decided you're going to stay on them, I wouldn't recommend you stay on them, but let's say you decide, well, I'm just going to stay on them anyway. I'd say you've got to take coenzyme Q10, anywhere between 200 and 400 milligrams a day, because you've got to have coenzyme Q10 for good cardiovascular function. Now, when you take cholesterol out of the system, it can cause a host of problems. It can cause brain dysfunction. It can cause a dementia type problem, global amnesia. And so here's some older folks, 60s or 70. That's me. I'm in my 60s. But so they start taking these
younger folks then, right?
Younger folks. I guess they're looking younger all the time. So we start taking this cholesterol, and all of a sudden it starts taking, this statin drugs, and it starts taking the cholesterol out of our brains, and then they don't think well. And then the family goes, Dad or Mom's starting to act like she has Alzheimer's.
Starting to lose it.
They're starting to lose it. Well, it's the statin drugs very commonly, and we have seen that in numerous patients that were on statin drugs who became mentally incompetent. And once you took away the statin drugs, they cleared up.
So that was the issue.
Yeah,
it's obvious.
Yeah.
Right.
So and so that's really, and then also it can affect muscle. So oftentimes patients will tell me when they get on the statin drugs, they start having muscle pains and ache all over, and it can adversely affect the muscle and cause something called rhabdomyolysis, which is a life-threatening disorder of the muscles, where the muscle tissue begins to break down. And that's due to the statin drugs. Plus, it begins to poison the liver. The liver's got to detoxify it. It's very powerful. So if you're taking statin drugs, your doctor's checking your liver enzymes. And it can lead to brain cancer, it can lead to liver cancer, a host of problems.
Weak bones even? Is that true? I thought that I heard that on the commercial once. One of the side effects was osteopenia.
Osteopenia, and I'm not sure that that's right.
Okay.
But it can besides mental confusion, it can lead to cancer, it can lead to liver damage and liver abnormalities.
If you want to know the side effects of it, just listen to the TV commercials. There's a good long list at the end. Well, so we talked about vitamin